evening and good to have you with us in this edition of the Urban Debate. If you are living in Maharashtra or Kerala, I'm afraid I don't really have great news for you. In fact, I have some worrying news. If you are in any other state across the country, I have a warning for you, a lesson that you must learn from what is happening in Maharashtra and Kerala. The two states that together now see over 70% of the cases in the entire country. And after weeks of having a control on the situation, after weeks of seeing a decline in the number of cases in India, genuinely feeling relieved about the fact that the COVID cases were falling, we are now looking at a U-turn in these two states. Now, many say we don't know what's going on. Can it just be blamed on economy opening up? Can it just be blamed on people not following the protocols? Is Maharashtra and Kerala really that starkly different in terms of forgetting to wear a mask in a crowded place from any other state across the country? People have let their guard down across the country. People are now pretty much done with the COVID norms and are beginning to let their guard down. Yet in these two states, we see a very concerning rise, especially in the state of Maharashtra, that recorded over 6,100 cases, new COVID cases, and 44 deaths in the state, making it the largest spike that we've seen in 75 days. That's the gap. That's the period of relief that we had before we reach this point again. Now, the Maharashtra government and local authorities have responded with stricter curbs, whether it's in the city of Mumbai, where the civic body has issued new guidelines. Mumbai itself witnessed over 800 new COVID cases and 5 COVID deaths today. Over 800 cases. Many of the states aren't even getting these many now. On the other hand, there are other cities like Amravati and Akola that have actually looked at a partial or a full 1 day, 1.5 day lockdown. Now, yes, the lesson from this for everybody can be that we need to ensure that we penalize those who don't break the rules. That we need to ramp up our RT-PCR testing to track the spread of the infection. We cannot reduce the testing even if we believe the number of cases have gone down. We need to follow the norms of quarantine and isolation. We need to keep a strict vigil over international travelers, and we need to speed up vaccination, most importantly, for the entire country. But let's ask our experts. If states like Maharashtra and Kerala let their guard down more than the rest, which is why they are suffering today, are we staring at a fresh COVID wave? What explains the sudden rise of cases in these states? And is higher testing and wearing a mask our only option out? Let's say good evening to the panelists who are joining me right now to have this conversation. I have with me Rajiv Pandey, spokesperson of the BJP, Dr. Raman Gangakhedkar, former head of the Epidemiology and Communicable Diseases at ICMR with us this evening, Professor Anupam Sibal, Group Medical Director and Senior Pediatric Gastroenterologist at Apollo Hospitals, Dr. Abhay Shukla, National Co-convener of the Swasthya Abhiyan. Also, we'll shortly have from the NCP, Dr. Sameer Dalwai, who is also a developmental pediatrician. Good evening to all of you. Dr. Gangakhedkar, one question that many people ask is, why just these two states? It's not to say that in other states, or is it that in other states people are a little bit more careful with their mask and social distancing?
No, it would be very difficult to comment and say that there is nothing that is happening in other states as such, because we do not know whether the offer of testing and the access to testing continues to remain the same in every state. That's number one. So if you actually look at these two states have continued to offer the test as much as they can. Though I must also say, if you look at the data that comes from Maharashtra, there is a small decline that you tend to see, which is visible in the number of tests that are conducted of recent versus what was happening in the past. But for Kerala, the number of tests continue to remain almost the same at this particular juncture. What is important for us to understand is Maharashtra is a large state which has higher population density, and as the lockdown is being lifted, you look at few cities that are very large cities and very dense cities, you find that locals are allowed. So essentially that becomes an issue related to mobility. You also realize that COVID appropriate behaviors are becoming less and lesser as of now. And this perhaps even this explanation doesn't really work well, because if you compare within Maharashtra, you find Vidarbha state districts like Nagpur, Buldhana, Akola, Amravati. These are showing emergence of a newer wave, which do not have similar kind of population density as the Western Maharashtra tends to have, which makes you think whether it is the events that are like marriages that are leading to such kind of resurgence, or is it also something which is related to lifting the lockdown to an extent that certain students from schools and and also colleges are supposed to go back to their classrooms, and if that is happening, perhaps we'll need to maintain a tight vigil. As far as Kerala is concerned, I still think that the first wave is yet to decline in Kerala, because they had a stronger lockdown with a comprehensive public health action. So Kerala continues to have a flatter, longer curve, which is currently seen. We hope that they will go for a decline, but this issue becomes very ticklish with Maharashtra.
All right. So for the two states, there may be different reasons, and I think largely many experts agree as far as Kerala is concerned, where they actually flatten the curve, as experts put it, very quickly, and which is why maybe now they are seeing a higher number of cases than in many other parts. But let me go across to Dr. Abhay Shukla. Dr. Abhay Shukla, you do very deep analysis of various parts of Maharashtra as well, the numbers that are emerging. What is your own view, or are we all right now simply in a guessing round because we don't know what it is which is happening here?
Yeah, so I agree with many of the points which were made by Dr. Gangakhedkar. In Maharashtra, we need to understand that we do not fully understand how this epidemic is behaving. It continues to surprise us. And one aspect of this is that when we thought that perhaps some level of herd immunity is being reached, actually, we have not reached substantial herd immunity, even in the areas where the entire epidemic has been at a high level of transmission for almost last 8, 9, 10 months. Which means that probably what is happening is that in micro clusters, in some areas, there is herd immunity, but other areas, there are still a significant number of susceptible people. So therefore, when gatherings increase, weddings are taking place, elections have taken place in some areas. When there is a gathering or an increase in interaction, then again the susceptible areas, we see a second wave of outbreaks. So probably this is what is happening. It's like there are significant number of areas which are still susceptible. So we have to ensure that the lowering of epidemic vigilance which has taken place in the population, that needs to be changed, and we need to go back to much higher level of vigilance. Gathering, crowd interactions must be curbed. They must be avoided. Mask usage must be stepped up. Interactions in large closed spaces be avoided. And at the same time, also need to see that the peak is much more was in mid-September. In mid-September, we had something like 3 lakh active cases in Maharashtra. Today, the total active number of cases is around 40,000. So it's much less than actually, what we had at that stage. But still, now in Pune, we have roughly half of the ICU ventilator beds are occupied in Pune city. So it's not as bad as it was at that time. We should note that. But the ramping up of availability of beds for critical COVID patients, including ICU and ventilator patients, that needs to be again brought back on the agenda. And in some cases where private hospitals have been earlier engaged, now they have been disengaged. We may need to again, go back to the earlier arrangements, at least in those areas which are having higher number of cases. And finally, the vaccine rollout is much slower than what is expected. And as a that and until now the vaccine doesn't seem to be playing much significant role in reducing the number of susceptibles in the population, which is an important, aspect. So it needs to be seen that why, we have something like 3 lakh vaccinations every day. If you want to reach 30 crore people in this country, it will require 1,000 days,
Yes.
which will be after, much late compared to the requirement. So is there a way, and the vaccine doses are available, but the
Okay.
vaccination capacity be ramped up. I think that is another point that needs to be kept in mind.
All right. So, several important points raised by both of you. Let me actually also bring in Professor Anupam Sibal now. Professor Sibal, could the factor that in states like Kerala and Maharashtra, you also have a lot of travelers from, domestic travelers who are moving into these states and out of these states regularly, international travelers who are coming into these states, which could have possibly led to several more versions of mutants or even some super spreader events?
Thank you, Tanvi. Yes, there are multiple factors that actually contribute to an increase in rise. Internal travel, external travel, both contribute. But I think if we look at whatever's happening in the world and what we are seeing in India, from the highs of 97,000 to 8600 early Feb, we are now again climbing to 13,000. So why is this happening? One of the reasons, and I think all of us will agree, is that the guard has come off to a significant degree. If you talk to most people, there is fatigue. After all, it's coming to 11 months since the lockdown, and people are getting tired. And we as experts are going on telling them, be patient, be more patient. They ask us, when is it going to end? And we have no answer. So I think we need to strengthen our communication strategy and reinforce to the community at large through clever messaging that yes, we have vaccines. Of course, we need to scale up and clearly, we need to get to the 30 crore figure, which in phase 1, I have to say, is very ambitious. After all, it's only 3 crores less than the population of the United States and 3 crores more than the population of Indonesia, the 4th most populated country in the world. So it's huge. It's mega. And I think what the first crore have taught us is that we have... I think a lot of the teething problems have gone and we need to scale up rapidly, and that will happen.
No,
But while
let me ask you, you say, and I agree with you, but that people are, in many parts just done with it. And as you open up, people tend to forget COVID still exists. But that would be true for any other part of the country as well.
Yes, and I think it also depends on the strategy in terms of testing access. It depends on the level of awareness. So there are several factors that go in. But I think we need to look at what Kerala and Maharashtra is showing, that, listen, we need to be very vigilant. We need to enhance communication. We need to enhance awareness. We need to continue with tracking, with testing and treatment. So I think it's important for us to see the signals that we are getting from 2 states and actually change our strategy, because we don't want to get to a stage where 13,000 becomes 20,000 and so on and so forth. Because as we all know, vaccination is going to take a while. It has to, and there is no shortcut there. But I think our behavior in terms of masking, our social distancing, hand washing, all these 3 need to be reinforced over and over again. People are going out for weddings. You'll have Holi come in next month. So, as more and more interactions happen, people tend to forget, and you tend to, people are fed up, they want to get back to a normal life. So we have to keep reinforcing, and that's really our duty to be able to do that.
Okay, fair enough. Let me also get in a quick comment from Mr. Rajiv Pandey, and we'll also have Dr. Samir Dalwai joining us in a bit. But Rajiv Pandey, these are actions that the state and the center needs to take together. Should the center also not be cracking the whip on the state and also pushing for more vaccination in states that are showing a rise?
Tanvi, I completely agree with you that center and state both has to work this, because this is a worrying trend. It is not for, the country is limping back to the normalcy on the economic front. And if today we put any like lockdown kind of things, then economic cost will be too high. That is my first view. Second point, what one of the esteemed panelists was saying, that, in Mumbai, the local train has started, and that's why this is happening. It's not like that. Local train in Mumbai, the minimum was 529 in this year, and it has gone to 800 and plus numbers. What I personally feel, that the guard has gone down, as well as the testing also. If you have to kill this virus, you have to go for extensive testing. The per capita testing in UP, if you see, the density of the people are much, much more in UP and Bihar compared to Maharashtra. One of the esteemed panelists was saying that because the people's density is there. No doubt, Mumbai I can understand because the density is more. But right now the center is emerging like Amravati, Yavatmal, Buldhana, whole Vidarbha. So what I feel that government will have to really invest time and energy, that we should do everything, that there should be no lockdown. Otherwise, if lockdown is there, then everything will be completely back to a square one. The second point, as far as the Kerala is concerned, there was a lot of talk about the Kerala model. Oh my God, it was a Kerala model. When it flattened, it has never flattened. If you see last 20 days, I was seeing the Kerala is the biggest contributor in the number of the new COVID infection, and at once around 40% of active cases in the country belongs to Kerala. So what I feel that there was a media management by Kerala government, and that's why there was a lot of Kerala model. That is the biggest failure. So let's not talk about any model. If you have to go by the model, go by the Yogi Ji model. It is 24 crores people. You see the performance. So what I'm trying to say, that let us not bring politics in this.
Why, you just did. You made it completely political by saying that it is about Yogi Ji's model and not Kerala model. Rajiv Pandey, there is a scientific point that I was making. I wasn't making a political point. Let me just clarify. You misunderstood what I said. You misunderstood what I said. When I said that they flattened the curve way too early on, I meant that because in the early on days, they managed to lower their cases, that a large percentage of their population hasn't been exposed to the infection, unlike the states like Maharashtra and Tamil Nadu and even Delhi. Sero surveys show that there is a prevalence, a sero prevalence of 30% to 40% in many parts of even the national capital. That's what I meant. So Kerala didn't see that then. They are seeing it now. So you can't give me a 20-day comparison. I was talking about a 9-month comparison, Mr. Pandey. Obviously, in the last 20 days, everybody agrees that Kerala is seeing a rise.
You are wrong. If you compare the population and the COVID infection in Kerala, it is almost 3 times than in UP and Bihar. Even election has taken place.
Let's not go to Bihar, please. You and I very well know the scams that are unfolding on a daily basis in Bihar.
Now you are changing the track. This is very sad.
Oh, okay. I will give you the facts. I'm not changing the track. In Bihar, district after district, the government itself is ordering investigations because of the investigation done by Indian Express that shows that the testing numbers have been a sham, that they haven't been testing the amount that they have been claiming. So please, let's not claim that Bihar has done a great job. We don't know what happened in Bihar because the data is not there to suggest it. Let's at least talk about some of the states where we know there is a crisis and they are responding to it and what could be going on. Now, hold on to some of your arguments because I will come back to you. There is a point to be made about the accountability of the governments. But I have another question for our experts here. And I am now looking at some of the reports that have emerged about mutant variations. And if there is a possibility that some of the local variations, Dr. Abhay Shukla, that have evolved in Maharashtra could be, spreading faster than what we've seen earlier. Now, we spoke to Mr. T.P. Lahane and he said, well, we don't have such evidence yet, but we are testing more samples. Is there any merit to be looking into this theory?
I think it's too early to make any such conclusion that, new variants are responsible. We don't have that kind of data in any concrete way until now. A lot of these phenomena can be explained even by the existing strains. And as I said, that, this existence of multiple pockets which are still susceptible and are now contributing to the second wave, we can explain this phenomenon even without having to resort to any explanation based on new variants. So until now, the evidence is still not out about any new variant. I think we should wait for the gene sequencing evidence to become available. Once that is available, at the most, what will happen is that even if there is a new variant, at the most there will be a higher level of infectivity. So it will somewhat modify the picture, but I think the core strategies will remain more or less the same. So I think let us not jump to conclusions about any new variant. Rather, we should see what can be done effectively. Even assuming that it is the same variant, but it has undergone a resurgence. Let us look at those strategies. I'd like to make two more points. One is that this weekend lockdown is not logical. I think Dr. Gangakhedkar will also agree with that. There is a certain logic behind having a lockdown. Just having a lockdown for 1 or 2 days and then opening up to normal, it doesn't interrupt the transmission in any significant way. So these are kind of cosmetic measures. Let us not go for that. Instead of that, I think controlling congregations, large gatherings, mass events of any kind, mass transport, the case situations where close contact takes place and where super spreading is likely to take place, I think that should be closely targeted across Maharashtra and even in other places. And the second point is about Kerala. Tanvi, I agree with what you said. Actually, Kerala was doing a reasonable job in the earlier phase, but it is a very high density population state, a lot of international travel, a lot of domestic travel, and various other factors have probably contributed to the resurgence in Kerala. And we still don't know what is going to happen tomorrow in other states. So today, these are the two states where there are high levels of testing and also a higher level of overall background of COVID transmission. So therefore, we are seeing perhaps a continuation of that in Kerala. So let us not, make a political statement about that. Instead of that, we should see what is the best possible that can be done in the current situation by more effectively implementing both public measures and the technical measures, including testing. I think testing needs to again be stepped up in Maharashtra if you want to know exactly what is going on. And of course, the issue of vaccination has already come up.
Yes. So, fair enough, and thank you for elaborating a little bit more on the Kerala aspect. But I'm just looking at some of the other comments which have been made, and I'm going to actually put out all kinds. We heard what Dr. Abhay Shukla had to say. Dr. Subhash Salunke, who is the advisor to the Maharashtra government, says that the strain spreading in Amravati, Akola is more transmissible. It appears that pneumonia is setting in early. Activity in these two districts is extremely unusual, although isolated in smaller pockets, and this is now being studied more. But Dr. Gangakhedkar, if you can shed some more light on this, because for a lot of us, we simply talk about COVID-19, and there is a UK strain, and there is a South Africa strain, and there is a Brazil strain. But in reality, there could be many, many more which already exist in our country, less or more dangerous.
Absolutely. So far, whatever data that has come from Maharashtra, it tends to say that there is E484 mutation, which has been observed in Amravati, which has been seen in a very small cluster. Now, I agree fully with Dr. Shukla that this doesn't necessarily mean you can attribute the whole thing, the whole resurgence to this particular strain. At the same time, I also agree with your statement that we also must be having different kinds of mutants which may be affecting the spread to be enhanced as such. But what one must also emphasize at this time point, that the mask tends to work the best possible way, whether it is a variant, whether it is a wild type virus that you are seeing in the population. So essentially what it would mean, variants is one issue, but if the population follows COVID appropriate behavior well, there is no reason for us to worry with respect to emergence of variants. But I would answer certain additional, perhaps provide certain additional information that whatever we know so far, why do these variants come? We don't have a specific antiviral, so it cannot be induced by the drug that we provide to them. It is perhaps coming up because of the immune response that people tend to have. And when it comes to immune response, there are two issues which we must remember. One is related to repeated use of convalescent plasma, which essentially puts in different neutralizing antibodies into the body of an individual while his own immune system is trying to fight. And it has classically been shown that if you use convalescent plasma repeatedly in a patient, you are more likely to encounter this problem because the virus faces a challenge to mutate if it wants to survive. The second issue, which is also important, which would be important from the point of view of vaccine strategies, is those who are immunocompromised are likely to have virus which survives longer than those who are immunocompetent. Now, if that is the case, we need to ensure that in the third phase, where we are talking in terms of population which has chronic morbidity and 50 plus people, now we should also think in terms of adding those who are HIV infected, those who could be having just addition of few conditions would also make it perhaps important in order to control this particular infection.
In fact, if I can, before I go across to Samir Dalwai and then Rajiv Pandey, one follow-up question to you, Dr. Gangakhedkar. These various evolved or mutated strains that may exist, how do we track them? Do we have a exhaustive setup across the country under the ICMR or another entity that is regularly collating and studying this data?
Yeah, actually, genomic surveillance was started in 35 virus research diagnostic labs in March, in the month of March itself. Now it has been also additionally expanded, taking up the institutions from DBT as well as DST under the leadership of NCDC. So genomic surveillance is an ongoing activity, but one must remember that when it comes to genomic surveillance, you tend to pick up a small proportion of sample to find out whether there is emergence of any variant. But looking at the large numbers that we had, it's very difficult to say that if you don't find any evidence of the same, that it is absent all over. So those issues will also become important. But genomic surveillance, yes, it is ongoing. There is no reason to be find a fault with the system whether genomic surveillance exists.
Tanvi, can I make a point on mutations, if I may?
Yes, please, go ahead.
So I think one of the things that we need to understand is that mutations are very common in different viruses. For example, in the SARS-CoV-2 virus, there are already more than 13,000 mutations. And we need to separate mutations from variants. And even in variants, we need to look at variants that actually have clinical consequences, which means either they're more easy to spread, or they produce more serious presentations, complications, or they have the ability to take on the vaccine that we are using. So I think there is a fair degree of confusion in the minds of the public at large who get very panicked about mutations. Well, mutations are common. And even with variants, we need to very carefully study what the relevance of that variant is.
Yes, absolutely. In fact, the response that we're getting even for local authorities is that kind of careful study and sampling is being done. So we shouldn't be rushing into really saying whether it's any different and more potent than what we've already seen. Dr. Samir Dalwai, but one aspect that many are talking about and has been raised repeatedly is that about testing. Now, we've been actually struggling to get some data from the Maharashtra government about how many RT-PCR tests have been conducted or are being conducted on a regular basis. We're not getting that breakup. Now, why is it so? And if the government is not tracking it, how do we know what's happening on ground?
Good evening. Well, I think numbers are being put out. Hello, are you able to hear me?
Yes, it's a little patchy. Your feed is a little patchy, but go ahead, please.
Are you able to hear me now?
Yes, I am.
Is there an echo? I'm so sorry about that.
No, this is fine. Absolutely fine.
Yeah. So every day the government, the Ministry of Health puts out the data of how many tests have been done and how many have been positive, and it's absolutely there in the public domain every day. I think the issue also is, I'm glad two wonderful senior doctors have discussed about the issue of the mutation as well. I think, according to me, what I would say is that the real issue is that in a population dense state like Maharashtra or Kerala, what's actually happening is that when the COVID pandemic broke, the lockdown was applied in the first few days, and that actually helped contain the peak. And there were many, obviously, which is why the peak, everybody was not infected. However, now with the restrictions being relaxed and with the unlock happening and with people getting back to their day-to-day lives, these small spikes are bound to be there in any new pandemic, any pandemic with a new virus. And what we are seeing now is these small spikes. And I believe till the entire population, 70-75% of them develop an immunity either because of a natural infection or because of a vaccine, they are bound to be these small spikes as and when certain measures are relaxed. So I think we need to continue with the surveillance, we need to continue with the testing, no doubt about that. What we also need to remember is the public at large, we need to continue the messaging, the public health messaging that people need to take care. They need to continue wearing the mask. They need to use measures to sanitize and they need to keep maintaining social distance. So though the people have been allowed to come out, go to work and all these things, we as a population need to realize that as and when we can avoid crowding, avoid going to crowded places, it's upon us to continue that because though the cases overall compared to last year have gone down. Unfortunately, the mortality, morbidity isn't as bad as it was earlier. We still need to understand that the pandemic is not over and we need to continue the measures in terms of public health safety.
No, fair enough, and I think that we cannot stop emphasizing on that enough, but really it's up to the people to how much they listen and then up to the government of how many stricter measures or penalties do they bring in for those who violate basic norms. And I'm not even talking about movement restrictions or lockdown kind of a situation. But Samit Alvai, I am looking at the testing data for Maharashtra and we do have the total figures which says on February 8th we carried out about 32,354 tests. By February 18th, we doubled it to almost doubled it to 65,930 odd tests. But we don't have the breakup. We don't know how many of these are RT-PCR tests or of the other kind, which ideally and in the initial days we used to get on a daily basis. But Rajiv Pandey, how do we ensure that we get a handle on this without going to the extreme measures like last year?
Oh, the senior doctors are there and they have rightly stated everything. First of all, everybody, every individual has to be more careful. My first point is that every individual across the country should not think that its COVID is over. That is my first point. The second point is that performance of the government has to be discussed. Everybody is saying it's a high density state, Kerala. Kerala is 40,000 square kilometer. UP is 2.43 lakh square kilometer. See the population, 6 times larger a state, but population is 8 times larger. All these things are not there. You cannot say that because of the density it is happening. And then earlier they were saying Kerala is having the best healthcare system in the country. So let's not talk about that. In my opinion, both the government, whether it is Maharashtra or Kerala, they should pull their shocks. They will have to do extensive testing and try to contain this virus spread. As far as mutation is concerned, because esteemed doctors have already stated, there is no visible data which says that it is the mutation virus or it is the old virus. So what I am trying to say, without going into that, everybody has to be careful about that. And second point, government has to do more. Whether any government, I am saying across the country, because if it bounce back, if any extreme measures is taken, the economic cost will be too much, and which I don't think that we will be able to withstand that. But the government should ask this question.
What the government should do, I would really appreciate some more guidance on that. What exactly he means by that? Because a few months back, their party was shouting hoarse that temples should be opened, mosques should be opened, schools should be opened. Now, I would like to know what more they suggest the government can do. We're very happy to listen to anybody who has
as far as the temple opening is concerned, when you opened everything, only you had stopped when you had put a lock on the temples. So that is a separate issue. What you can do more, I am requesting you that you enforce the guidelines. If the police and civic authorities should go ahead that people are wearing masks. Mask is the only thing which can protect from all kind of virus. That is one. You can do extensive testing. You can find out that how this is not being followed. You come to I don't want to take the area because I have stated to Tanvi Shukla ji in other earlier shows also. You see how people are behaving. You will have to do these things. If that is the case, I told you, UP is having 24 crores people. How it is managed? You should go. Then you should send your people to learn that how Noida was completely, which was becoming the hotbed of the COVID infection. Now completely Noida, you should go and find out that how
Why don't you tell us? Why don't you tell us?
From that.
You seem to be well informed. Why don't you tell us? It's very clear. It all depends on the amount of testing that is being done. Maharashtra definitely is one of the states with the highest amount of testing per density of the population. Let's understand that the amount of traffic in and out of Mumbai as well as other key states of Maharashtra is bound to be the highest. This is not a time for a political debate or political upmanship. There are various issues on. There are political election campaigning and election sloganeering that is also going on. So we should not get into those debates. The point is about eventually, I agree, and I think my friend Mr. Pandey also agrees, that eventually it is up to the people. Now, how much we are strict with them,
I think
how much we
enforce that I have stated so. My first line was that.
Fine, I agree.
Okay, all right. So the onus is on the people. The onus is on the people to, again start following the norms. I take that point, but I am going to, and I don't want to repeat myself, but I want to go back to our experts and ask this question. Professor Sybil, let's start with you this time. How is it that we saw in the last 2 months India getting a relatively better control with low number of cases, a constant decline, even though we were opening up then? If I had to ask you what changed between the first week of January and the first week of February, especially for some of these states, is there an explanation right now? Or is it because it's a new epidemic, pandemic, and we don't know how it still functions to a great extent? We really don't know these questions, so the safest way is to just wear a mask and go on with your life.
Tanvi, very important question you raise, and I think we're learning every day. I mean, just to give you a sense, there are more than 104,000 papers published on COVID-19 on PubMed, which is the US database where all published papers go, and that works out to 251 papers a day. That just goes to prove that there's just so much that we don't know and that we are struggling. So if you ask me what is the precise reason why this is happening, the answer is I don't know. What we can definitely throw there some hypotheses. I think there is exhaustion that has set in. And, when you see a newspaper report or you see your channel and other channels and they say, well, the numbers have come down to 8,000 on 1st of February, you start feeling really happy about it. And you said, oh, right, we've won this battle. And okay, I'm taking my mask off and I'm going out for that coffee that I've been waiting for. And I'm actually going to get together with friends and the wedding season's on. And I think it's a lot of these little factors coming together. Basically, people letting their guard down, people getting a sense of it's going to be okay. And that's where social distancing takes a toss. The mask goes off, hand washing goes off. And we know these three things. SMS is what's going to save us, what has saved us, and what is really the tool in hand for months to come while vaccination spreads across the country. Vaccination is not going to happen overnight. It's not really going to be the magic bullet. It's going to be SMS plus vaccine. So I think that's really the reason why this has happened. And I'm concerned about what's going to happen with Holi.
Yes, I mean, every next festival or wedding season that comes becomes a challenge where I think we also in many states have opened the schools. Kerala has actually seen specific examples of these super spreader events, as they are calling it, where in a couple of schools, when they tested, they found that 200 people between students and teachers had tested positive. And, 2 or 3 instances like this can completely throw you off your balance in terms of the numbers that you're registering on a daily basis. The same goes for maybe even Maharashtra, where in cities and districts where we hadn't seen it the first time is where we're seeing the higher load, apart from the usual suspects like Mumbai and Pune. Well, I'm completely out of time, but I just want to very quickly also check with Dr. Gangakhedkar if he wants to add to this. Dr. Gangakhedkar, how is it that between January and February, not much has changed in terms of opening up, and yet we were doing well then and are not doing so well today?
But it's very difficult to give an exact answer for the same. But, I think it is something which is related to the population that tends to go out and becomes mobile during different periods. If you have a lockdown like we had in the beginning, we found that, let's assume an X percentage of people were more likely to go out and they were required to go out. And they were more likely to get infected or exposed, and that's what essentially is seen, whether it is in the containment zones or whatever. Now, when you start lifting the lockdown, a newer group of people who were perhaps not exposed before are coming into becoming more mobile, and the result is they continue to remain vulnerable, and therefore the likelihood that they will get infection continues to exist there.
Okay.
And one of the reasons why you are perhaps seeing that wherever the first wave was smaller, you find that the second wave tends to become larger. Wherever the first wave was large, you find that the second wave that tends to come has a small bump.
All right, fair enough. Completely out of time, but I really appreciate all of you joining us. And the reason we want to do more and more of these conversations is actually to make people aware that the threat hasn't gone away. And if you look at the pace of our vaccination, 1 crore beneficiaries in over a month, we are still moving very slowly. So larger relief is far, far away. The only way out, because we don't have too many answers to what's going on, the only way out is to wear a mask and is to follow the COVID protocols. COVID hasn't gone away. You may feel like you want to do a lot of travel, attend a lot of big crowd events, occasions and weddings, and shop every now and then, or go out to restaurants, but keep this in mind, that every time you do step out, the least you can do is sanitize your hands frequently, wear a mask and maintain some amount of distance, because COVID hasn't gone anywhere. And we're still trying to figure out what happened 2 months ago and what's going on now. Thank you so much for joining us on this conversation.
Co-powered by Kalyan Jewelers. Trust is everything. In association with Natura More. अंदर से फिट.
InsuranceDekho.com. सही इंश्योरेंस कंपेयर करो, सही प्राइस पे ले लो और क्लेम सपोर्ट हमारे हेल्प डेस्क पे छोड़ दो. आप इंश्योरेंस देखो, बाकी हम देख लेंगे.
AIMS, empowering minds.
All new Safari, test drive and booking open. Delivery start 22nd February. Reclaim your life.
Well, we in fact also spoke with the Director of Medical Education, Dr. T. Lahane, about the surge in COVID cases. This comes amidst reports of possibility of a mutant strain that may be unique to parts of Maharashtra and leading to a rise in cases. And Dr. Lahane says, we haven't found anything yet, but the tests and sampling is going on. Listen.
नहीं, जो बात चल रही है, मुझे लगता है कि ये सम मिसअंडरस्टैंडिंग कहीं हुआ है. जो 12 टेस्ट किए गए हैं, वो 12 टेस्ट उसमें से 4 अमरावती के हैं, 4 यवतमाल और 4 सातारा के हैं. ये चारों टेस्ट में जो पुराना जीन है अपने पास जो होता है, दैट इज़ D614G, यही आ गया है. कहीं भी म्यूटेशन या ब्राज़ील, दक्षिण अफ्रीका या इंग्लैंड का नया स्ट्रेन मिला नहीं है. तो इसलिए ये नया स्ट्रेन आया है, ये गलत है. महाराष्ट्र में नया स्ट्रेन आया नहीं है. जो आंध्र प्रदेश में मिला है वो स्ट्रेन अलग है, और आपने पास जो मिला है वो अपना पुराना स्ट्रेन है. नया स्ट्रेन आपने पास नहीं आया है. ये जो एपिडेमिक डिसीज़ होता है, आपने अगर H1N1 देखा होगा तो हर वक्त वो पुणे में बढ़ा है. अभी पुणे में जब भी बढ़ता था तो क्यों बढ़ा, इसका रीज़न अपने पास आज भी नहीं है. इसलिए ये जो एपिडेमिक डिसीज़ होता है वो कुछ एरिया में उसके अप्स एंड डाउन्स होते हैं. वैसा ही ये अप्स एंड डाउन्स है. और इसमें बेसिकली जो अपना फ्रीडम मिला अपने को, जैसे नंबर कम हो गया तो मास्क लगाना बंद हो गया, डिस्टेंस अपना क्राउड होना शुरू हो गया, अपना जो हाथ धोना है वो बंद हो गया. इसलिए जो कोविड का बिहेवियर अपन पहले कर रहे थे उसमें मुझे लगता है कि थोड़ा सा लोग ये सेल हो गए, इसके वजह से ये बीमारी बढ़ गया ऐसा लगता है. बॉम्बे में अपना टेस्ट नियर 18,000 तक बढ़ाया है, और बाहर भी अपन उतना ही टेस्ट कर रहे हैं. तो अपने 30 से 35-40 इतना थोड़ा कम ज़्यादा, जो छुट्टियों में थोड़ा कम होता है, बाकी के दिन और बढ़ता है, इतना अपन टेस्ट कर रहे हैं.